Hi, good afternoon. So I have the opportunity to provide a couple of minutes of comments about what the opportunities are in the health sector, and I feel that I would be remiss if I didn't start off my comments by saying that we need to consider the role of the health sector in the context of the fact that people are engaging their healthcare providers a couple of hours a year, a couple of days a year, if you're really sick, a week a year. The rest of the year, consistent with what Don was saying, the community is really the provider, the caretakers. People are really much more heavily influenced by the places that they live, where they go to school, where they go to the work, et cetera, than they are by their healthcare providers. That being said, there are some real table stakes that the health sector has to as responsibilities here. So I wanted to mention a couple of major focus areas that I think healthcare needs to really step up to. The first in the clinical realm is this area of the 5 A's. And those A's stand for asking patients or members about their readiness to change, assessing their risk, advising them on risk and therapeutic alternatives and having conversations, agreeing on the treatment plan, and then assisting or arranging for the necessary resources for people to take the first step. I think much of the health sector has been focusing on that first A, assessment. BMI is a vital sign in particular. And that's a really important thing. It's a fabulous first step, and it's wholly inadequate. Just knowing what our patient's risk is doesn't really get us very far along the road. And in particular, as important as BMI assessment is, there's some other assessments that are really important to do, and looking in particular at assessing people's behaviors, and exercise as a vital sign is something that Kaiser Permanente has been implementing over the last couple of years. We're really excited about it. We're seeing that it's leading to conversations between caregivers and members about their physical activity, and it's leading to changes in physical activity levels. And I think it's a whole brave new world around not just BMI as a vital sign, but exercise as a vital sign, and then a whole integrated physical activity pathway that leads all the way through. And we aren't very far in the area of asking about people's food and beverage intake and their choices. So I think that's an important assessment area. But assessment is just the first step. The place that we really need to focus on in those 5 A's is around the advice and the quality of advice. And many in this audience know about the work around brief negotiation and motivational interviewing. It's quality prevention, it's quality conversations that need to happen. And too many of our providers are not equipped, not us in Kaiser Permanente, but us as a country. Too many of our providers are not equipped to have those very very complicated conversations with patients about their weight using behavioral science. There is training that's available. Kaiser Permanente has put together online training. Other organizations have as well. And I think our providers really need to get fluent in brief negotiation and motivational interviewing. I'll also say that from our organization's perspective, we really need to move beyond this notion that a quality engagement, a quality encounter is all about motivating people to change. People that have overweight and obesity problems are plenty motivated to change. The issue is not motivation. As B.J. Fogg and others that are in the behavioral science area are helping us understand, it's really much more about lowering the threshold of activation and triggers. And the health sector needs to understand the new science of behavioral design, lower the activation threshold, put sticky triggers in front of people, and use that as part of the encounter. Thirdly, we really need to focus much more on that assisting role and advise and helping people connect to outside resources. This leads us into this area of clinic to community integration. It's been talked about a few times today. That is the brave new world. What is the role of the medical industrial complex to connect its patients, its members, to this vast array of community-based resources, be they community health workers or evidence-based programs like the Diabetes Prevention Program or Men for Kids, and what are the financial models, what are the referral models, how is that all going to work? Really, really important. The second breakthrough thing, as my flashing red light is going off, is that we cannot stop with the 5 A's and clinical interventions. Healthcare, as 18% of the GDP, as the largest employers in so many of our cities and towns, have an obligation and some power to influence the community environments that our hospitals and our medical groups are in. We need to seize the levers of change. We need to model healthy behaviors by doing those changes for our own employees, and by funding, by using our civic leadership responsibilities, using our grant money to really change the community environments. For the first time, because of the Affordable Care Act, every single nonprofit hospital in the country has to do a community health needs assessment. We've been doing it for a number of years. We just finished this cycle in every single one of our communities. Poor environments that do not support physical activity and problems with the food environment were surfaced as a priority issue, and we really need to step up to make those changes, to make the healthy choice the easy choice, and we need to start with our own employees and our own facilities. So those are the two breakthrough things that I wanted to offer up, and I look forward to the rest of the conversation.